Did you know that nearly 1 in 5 adults in the US live with a mental health condition? What's even more alarming is that some of the medications we rely on daily could be making these issues worse. It's easy to assume that if a doctor prescribes a medication, it must be safe in every way. But the truth is, certain medications can have unexpected side effects, quietly affecting your mental well-being. Imagine taking something to improve your physical health, only to find out it's causing anxiety, depression, or even more serious mental health challenges. This isn't just a hypothetical situation, it's a reality for many people. And it could be happening to you or someone you love without even realizing it. Today, we're diving into a topic that doesn't get talked about enough: the hidden mental health risks of some common medications. This information could be crucial for your well-being, so it's important to stay informed. Let's explore which medications could be affecting your mental health and what you can do about it. Your mental health matters, and understanding the risks is the first step to protecting it. Number 1, corticosteroids. Corticosteroids, like prednisone, are often lifesavers for many conditions. They're powerful drugs used to reduce inflammation, treat autoimmune disorders, and manage severe allergies. But what many people don't realize is that these same medications can have a significant impact on your mental health. It might start with something as subtle as mood swings. One minute you feel fine, and the next, you're anxious or irritable for no apparent reason. Over time, these emotional shifts can become more pronounced, leading to feelings of depression or anxiety that can be hard to shake. For some, the effects can be even more severe, causing confusion, paranoia, or even hallucinations. The hardest part is that these changes can sneak up on you. You might not immediately connect how you're feeling emotionally with the medication you're taking for a physical condition. That's why it's so important to be aware of these potential side effects. If you or someone you care about is on corticosteroids and experiencing unusual changes in mood or behavior, it's crucial to talk to your doctor. Understanding the risks can help you manage them better, ensuring that you're taking care of both your physical and mental health. Number 2, benzodiazepines. Benzodiazepines like Xanax and Valium are commonly prescribed to help with anxiety, insomnia, and even seizures. They're often seen as a quick fix for calming nerves or helping you sleep. But what many don't realize is the potential long-term impact these medications can have on your mental health. At first, they might seem like a lifesaver. Finally, you can sleep, or that overwhelming anxiety starts to fade. But over time, the story can change. These medications can be highly addictive, leading to dependency without you even noticing. What starts as relief can slowly turn into something much more challenging to manage. The effects on your mental health can be profound. Some people find themselves sinking into depression, feeling a constant sense of emotional numbness, or struggling with memory and concentration. The worst part is when you try to stop. Withdrawal can bring on intense anxiety, panic attacks, and even more severe symptoms. It's a difficult cycle, and one that can be hard to break without support. If you're taking benzodiazepines, it's essential to be aware of these risks. Speak openly with your healthcare provider about any changes you're experiencing. Your mental health is just as important as the condition you're treating, and understanding these risks is key to protecting it. Number 3, antidepressants. Antidepressants like Prozac and Zoloft are often prescribed to help lift the weight of depression and ease anxiety. For many, they're a beacon of hope during some of life's darkest moments. But, as with any powerful medication, there's another side to consider, one that isn't always talked about. When you start taking antidepressants, it can feel like a step toward regaining control of your life. But sometimes the journey isn't as smooth as expected. For some, these medications can initially increase feelings of anxiety or agitation, leaving you more on edge than before. In certain cases, they can even bring on thoughts that are darker and more troubling, especially when you first begin treatment. The challenge is that these side effects can be confusing and frightening, particularly when you're already struggling with your mental health. It's important to know that these reactions aren't uncommon, and they don't mean you're beyond help. Sometimes, it's a matter of adjusting the dosage or finding a different medication that works better for you. If you notice any unsettling changes in your mood or thoughts while taking antidepressants, reach out to your doctor immediately. You don't have to face these challenges alone, and with the right support, you can find the help you need. Number 4, beta blockers. Beta blockers, like atenolol and propranolol, are widely used to manage high blood pressure, heart conditions, and even anxiety. They're effective at slowing down your heart rate, helping you stay calm in stressful situations. But while they do wonders for your heart, they can also have a surprising impact on your mental health. At first, taking beta blockers might feel like a relief, especially if you've been dealing with anxiety or heart palpitations. The physical symptoms ease, and you can finally breathe a little easier. However, what many people don't expect is the emotional dullness that can follow. You might start to feel like you're going through the motions, emotionally detached from the world around you. For some, this emotional blunting can lead to deeper feelings of depression or fatigue. It's as if the medication that's helping your heart is quietly sapping your joy and energy. This disconnect between body and mind can be disorienting and hard to recognize as a side effect. If you're on beta blockers and notice changes in your mood or emotional well-being, it's important to talk to your doctor. You deserve to feel whole, both physically and mentally. Sometimes, small adjustments can make all the difference in ensuring that your treatment supports every aspect of your health. Number 5, antipsychotics. Antipsychotics, such as risperidone and olanzapine, are powerful medications used to manage conditions like schizophrenia, bipolar disorder, and severe depression. They can be life-changing, providing stability where there was once chaos. But like all strong medications, they come with their own set of challenges, especially when it comes to mental and emotional well-being. When you first start taking antipsychotics, the calm and clarity they bring can feel like a blessing. They help quiet the noise, making it easier to navigate daily life. But over time, some people notice something else happening, an emotional flattening. The highs and lows of life become less intense, but so do the everyday joys and passions. This emotional blunting can leave you feeling disconnected, almost as if you're watching your life from a distance. It's a strange and unsettling feeling, especially when you're longing to feel more engaged with the world around you. For others, the side effects can include sedation and cognitive dulling, making it hard to stay sharp and focused. If you're experiencing these or any other changes while on antipsychotics, it's crucial to discuss them with your healthcare provider. Your mental health journey is deeply personal, and finding the right balance in your treatment is key to living fully and authentically. Next, what to do if you're affected. If you're noticing changes in your mood, behavior, or mental clarity while taking any medication, it's essential to take action. The first step is to talk openly with your doctor. They're there to help, and adjusting your medication or dosage might be all it takes to improve how you feel. Don't hesitate to ask questions or express concerns. Your mental health is just as important as your physical health. Sometimes, finding the right treatment can involve trying different approaches, whether it's switching medications, incorporating therapy, or exploring lifestyle changes. Remember, you don't have to go through this alone. Support from healthcare professionals, loved ones, and mental health resources can make a world of difference. Most importantly, trust your instincts. If something doesn't feel right, it's worth addressing. Your well-being matters, and taking steps to protect your mental health is a vital part of taking care of yourself. In navigating your health journey, open communication with your healthcare provider is key. If you're experiencing any changes in your mental health, don't keep it to yourself. Your doctor is your partner in health, and together you can find the right balance to ensure both your mind and body are taken care of. Remember, informed choices are powerful. Understanding how your medications affect you allows you to take control of your health. Never underestimate the value of staying informed and advocating for your well-being. If you found this information helpful, consider subscribing to our channel for more insights into managing your health. We'd also love to hear from you. If you've had experiences with medications affecting your mental health, share your story in the comments. Your voice could help others facing similar challenges. Together, we can build a community of support and knowledge.